Hello, good morning, everyone. Today, I will discuss about the Madras Health University previous year staffness paper. So, first question is for tracheal intubation of a child of 6 years uncuffed tracheal tube of a following size would be appropriate. Which size is appropriate means we have to make a basic calculation about the tracheal intubation. So, after the calculation, we can find the answer of 5.5 mm per ID intratracheal tube. Hemophilia is a characterized by a deficiency of factor 8. Which of the following is a normal position of the uterus? We all know normal position of the uterus is anteverter and anti-flexed. The next question is a 34-year-old female has a 3-month history of disturbed sleep with the early morning awaking and decreased appetite and lethargy and multiple body pains and feeling low and worthlessness, and most appropriate treatment in this case will be. These are the symptoms of depression. So we have to give the antidepressants. So its most appropriate treatment is in this case is antidepressants. Next, lactose is composed of following two sugars. What are the two sugars? Lactose is a glucose and galactose. 25 years old female presents with repeated vomiting and several episodes of low grade fever. On examination, she was azoteric and had a right upper quadrant pain. She also gives a history of recently returning from the area which she had a poor hygienic and sanitary condition. What is the most likely diagnosis? These are the symptoms and the history shows the hepatitis A infections. When a nurse performing a surgical hand hygiene, she must be put the elbows above the elbows. A concentration of oxygen in expired air is 16. So what about the inspired air? Inspired air is about 21 percentage. The appendix is located in the right, we are all know, right iliac fossa. How much distance between maintained from the bilirubin to neonate? What is bilirubin? Bilirubin is a phototherapy. Phototherapy to neonate. What is the distance? The distance is 45, not less than 45 centimeters. Which of the drugs is used to reverse the action of skeletal muscle relaxants? So we all know skeletal muscles have an antidote is neostigmine. A client arrives at the hospital at 38 weeks gestation with the profuse vaginal bleeding. She states that it occurred suddenly without any contraction. Note, this is a suddenly without any contractions. Which condition may the client be experiencing that requires immediate notification to the healthcare provider? It's an emergency, which is symptoms are painless. Vaginal bleeding is also always called as placenta previa. What is the color of peripheral venous catheter 16 gauge? It's always a gray. A patient presents to a emergency department with a complaint of watery diarrhea for past 3 days. How many days? The past 3 days. Assessment findings includes a blood pressure of 100/60, the pulse rate is 98 and dry mucous membrane. The healthcare provider would anticipate the intravenous therapy administration of which of the following fluids? Those are symptoms of patients going to be shocked. So reverse the patient using the isotonic crystalloids. Example NS and oral. Which of the following a side effect of phenytoin? Eptoin is side effects come hypertrophy. The earliest identify sign for developing a pressure sore on the skin is localized as change in color. A 36-year-old multigravida who is in 14 weeks gestation is scheduled for an alpha fetoprotein test. The alpha fetoprotein test is an indicator of we all know it's a neurotubal defects. Vitamin A supplementation given to your child from the age of 1 to 6 years for every 6 months. Which nursing action is the most important while caring for a client after cardiac catheterization? Is it check the pulse distal to the puncture site. Nurses carrying a primary gravida during a labor, what does a nurse observe indicate the birth is about to take place? The perineum begins to bulge with each contractions. The purpose of cuffing the endotracheal tube is provide airtight seal in trachea. For a chronic obstructive pulmonary disease, the patient in an ICU, following is a preferred device for oxygen supplementation is it's a Venturi mask. Very low amount of oxygen should be given at a fixed rate. While using the fixed rate, the Venturi mask is a correct option. The helmet maneuver used for removal of foreign body from the trachea. Which of the following antihypertensive drug is contraindicated in pregnancy? We all are having options like enampril, hydralazine, metoprolol, alpha methyl dopa. And alpha methyl dopa, metoprolol, hydralazine, all three are given in pregnancy at different trimesters. The odd one out is enampril, which is contraindicated in pregnancy. The reattribution therapy is used in the somatoform disorder. It's not used in the psychosis or depressions or mania. Yeah, client is scheduled for a sigmoidoscopy. What instruction should the nurse provide the client is preparation using for the diagnostic procedure? Withhold the food for 24 hours before the test. Not 24 hours before test. A sterile container will be provided for the stool specimen collections. Not a stool specimen examination. It's a sigmoidoscopy. A chalk-like substance will have to be swallowed. Not to be swallowed. Have an enema at morning of the test. This only conditions. The enema should be given where empty the sigmoid colon. The granuloma arthritis is a term applied for the inflammation of arthritis is the inflammation of testis. Convert the 40 degrees of Fahrenheit using a Fahrenheit formula, conversion formula. We have to answer a 104. The fetal heart rate can be auscultated with a fetoscope at a 20 weeks gestation. It may be vary with a using a ultra UHG. It should be a different weeks. Here the different weeks. Using a stethoscope, we have a different week. Using a fetoscope, it's 20 weeks. The agent used to disinfect the blood linen of HIV positive patient is sodium hypochlorite. Sodium hypochlorite, the percentage is 1% sodium hypochlorite. Using a sodium hypochlorite, HIV patients blood linen and any blood spillage should be removed. So thank you for watching. Another 90 questions is remaining in different parts, waiting for another part part B. We have to discuss about the another 30 question from the Banaras Health Indus University. Thank you.